Liftoff of mission 41B, first flight of the orbiter Discovery, and the shuttle has cleared the tower.
Hey, what's going on, you guys? Welcome to Health or High Water Podcast. This is Brett. I'm here with a room full of people. Number one, right away, Mr. Tom Finley. I'm going to give you a good introduction, but thanks for coming. How you doing today?
I'm doing great. How you doing, Brett?
I'm doing excellent. Thanks again for taking your time. I'm going to give you a nice introduction, but before we do that, I want to go around the room and do any news. We got Bethany from Pelvic Harmony, of course. How you doing today, Bethany?
I'm doing great. I was just saying it's Taco Tuesday. I'm so excited.
You were on a 4-week hiatus from Taco Tuesday.
Yeah, so I'm dead. I'm ready for more.
My invite must have got lost in the mail this week. What's up, Trip? How you doing over there?
Oh, man, I'm doing fantastic. I came in a little bit late because I was teaching some boxing. I'm sorry it took me so long to get changed. First time I had to bring real person clothes in a while.
Trip's usually in gym shorts and athletic wear.
Athleisure.
Let's do a quick news update over at Pelvic Harmony. What's going on? I know you're at Orange Theory doing some stuff.
Yeah, I'll be at Orange Theory Wash Park this Thursday in the morning, probably into the afternoon as well. I'm doing a raffle, so come show up if you're an Orange Theory member. You can win some free stuff, and I got to see some family last weekend in North Carolina, which was really nice. Got everybody together again, and one of my clients right now, who's pregnant, is currently in the hospital. So she should have her little girl today. I'm so excited.
Oh my gosh, that's got to be a crazy exciting experience to see from, being pregnant and then going through that process with you.
Yeah, she's so excited.
And she's going to stay with you through the process? Oh, that's awesome. Trip news, anything on your end in genetics or boxing?
Yeah, so we actually just finished our comprehensive wellness profile number 2. It's way more in-depth with easier information for it. And for you guys that don't know, our comprehensive wellness profile uses genetics, blood work, biomechanical assessment, and medical history to come up with an individualized program that'll get you all the way from a workout to a diet plan, injury prevention, cancer risk, cardiovascular risk, the whole big deal. And I got some big news. We have Ascent Performance Training has officially been open for a year as of the 11th.
Let's go.
Yeah.
There's confetti in here. You guys can't see it.
It's raining down. You guys can't see it.
All right.
So we're amazing. Thank you guys so much for sticking with us and watching us grow over this year. We would not be here without you guys, the listeners, and everyone that supported us, as well as we have 2 new countries that have been downloaded for the Health or High podcast. Welcome, Serbia and Austria to the fold.
Yes.
How many countries is that total?
We are at 60 so far.
Let's go.
Oh, let's.
All
60
right.
so far. That's it for me.
Well, thanks, listeners. Let's dive right in. I'm just going to give you a quick little introduction. Ascent, if you're in Denver, Ascent Living Communities has 5 different communities in Denver and around Denver as well. Tom, you're one of the principal founders and owners. You guys do some incredible stuff. We're grateful to be working with you guys, and that's kind of why I'm glad to have you here. We're going to get into some things all surrounding that today. You kind of, from your start, you were an analytical guy. We were discussing before this. You have a background in taxation, a master's degree in taxation, a bachelor's in accounting. You went to school in Arkansas. Are you a native Coloradan?
I'm not. I did grow up in Arkansas, small town there. I went to school there and then went out to DU to get a master's degree in taxation because, hey, all the chicks want the guys with a master's degree in taxation, right? So, and from there, worked for Arthur Andersen for a few years, and then kind of went a different direction in the world of finance. So that's where it started. Fast forward a couple years from there, I ended up working for a group that was building different types of senior living, different types of housing, and senior living was one of them. And I saw something pretty cool when I was there. I saw that when a senior living community opened, I saw really 3 cool things happened. One, you saw the lives of the residents really improve. Mm-hmm. They go from living at home by themselves to a place where there are supportive services for them in really kind of whatever capacity they need. So their lives improved. And then I saw that the lives of the adult children really improved because they could put their head on their pillow at night knowing that their mom and dad are taken care of and there's eyeballs on them literally 24 hours a day. There's someone always there in case something happens. And the third thing I saw that was really cool was that we create a lot of jobs. And so there's this really positive economic impact for the community. So really that kind of trifecta I saw really drew me into the business. And that was let's see, I started this company right about 16 years ago. 16 years ago in July. So my oldest son was 4 months old at the time, and today he started his junior year in high school. So that's going to date me a little bit, but that takes back to the beginning. And since then, we've stayed pretty focused on Colorado. We develop, own, and operate senior living communities, independent living, assisted living, and memory care.
Yeah. So going back to that time, who introduced you to senior living? Was there a moment? Was it like a couple months of research? Somebody had said something?
Yeah, the guy I went to work for that was building different types of housing. I mean, I got to work on a development that was senior living, and it was really more on the real estate side. It wasn't really the operations, but I felt like I needed to understand what was going on the operations side. And being an analytical guy, I took a look at the pro forma, and I see all these line items. There's all these different departments, all these different things that had to happen in the building. Really we're running. It's a hotel with healthcare services, really. So, there's a lot going on in these buildings, and they run 24 hours a day, 7 days a week, 365 days a year. So, it was super interesting to me. It looked very complex. It looked, and I saw the things that I saw that sort of drew me in. And that was a job that I had, back in 2007 and 2008.
Was there, getting into it as you started to kind of immerse into it, was there a big learning curve for you, or did it feel like, oh, this is right up my wheelhouse, I just hit the ground running?
Yeah, I mean, the learning curve lasted probably 10 years. I mean, I'm not kidding. It took that long. I mean, really to truly, get in, understand it, put all the pieces of the puzzle together, make it all happen. It took a long time, and to start it from nothing, and build it into something, it takes effort, and you have to really stay focused on your North Star as you're building this, and make sure that you don't, get involved with the wrong people. You do the wrong thing. You always do what's right. And if you sort of keep your nose pointed in that direction, you're going to be fine. Now there's a lot of luck that has to happen along the way, of course. A lot of hard work, a lot of long days. But now we're very fortunate. All the work that I felt like, the work that was the work of a few back then is now the work of many. We're fortunate, as a company we have about 500 employees. We're all in Colorado. We only will operate in Colorado, and I think that's one of our competitive advantages for sure. We view senior living as something that's very local.
What's the decision behind? Is it the local, like, hey, we want to keep things small? Is it just a bunch of things that made the decision of staying local?
No, not necessarily. It's a decision to want to be hands-on and to be involved and to be available for not only our teams, but also for the families, for the residents that live in our communities. My wife Susie, who's also in the senior living business with me, we own and operate the company. I mean, we now have second generation families that are living in our communities, meaning the parents moved in 20 years ago, and now the children are our residents today. You just don't see that in our business. And to be really geographically disciplined and to say, we're going to stay right here, we're going to be Colorado, there's literally nothing that can happen in the senior living business that I can't figure out, that I can solve pretty quickly. I mean, I've been doing this for a long time, and we have a great network here, and we know how to operate within our network. It would certainly be exciting to leave the state. Some people like getting on airplanes and flying off to do work.
I get it.
I like to get on an airplane and go somewhere fun,
Go
for a vacation. Yeah, go for a vacation or go visit family or go to a work conference or something like that. So it takes a lot to want to be very local, and there aren't many companies like ours out there that have made this decision that I'm going to stay local to my home state, and I'm going to make sure that we don't want to be the biggest, but we certainly have every intention to being the best. So that's how we approach the business.
Tripp and I have this conversation about online clients. We have the opportunity to take clients online, and Tripp is great at it, and it does expand our reach for sure, but I personally feel like I lose that touch, and I don't know if that's sort of the sentiment you're echoing is there's a chance to lose that touch. You're so close to, you could stop by, you were saying before the podcast, you had already stopped by 2 facilities today.
Yeah, I've been to 2 of our communities this morning.
Yeah.
So, and that's what matters. And you're there, and you get to, we're there. We're meeting with our teams a lot of times, but you overhear conversations, and you have these interactions with the residents. And it's so funny this morning. I've literally never had this happen before, but I walk in, and there's one of our residents. She's probably 90 years old. I walk in, and she's like, "Oh my gosh, you're so handsome." I said, "Well, thank you." I said, "You just made my day." She said, "Are you married?" I said, "I am married, and also I'm the owner." And her granddaughter is sitting there, and her granddaughter just melts into a puddle right then and there. So, but you know what? You walk in, and she just laughed, and we had a great moment. But these are the things that you get to experience when you stay local. When you the things that made you successful yesterday are not the things that aren't going to make you successful tomorrow. And all that hard work that made your first operation a success, because you're going to fail. You're going to have days that don't go your way, but you have to look at the big picture, and you have to say, okay, over the course of this period of time, we've done good things. We've improved lives. We've made great progress. Can we do it again? I think we can do it again. And then you do it again, right? You do it again in your backyard, and then you do it again and again. But the thing is, can you do that again if you're not there? And that's a hard decision, because look, there's a lot of reasons to want to, expand beyond, this sphere that you operate within today. And one of them might be capital investment. The investors might say, "Hey, we think you're great. Can you go do this in Utah? Can you go do this in Arizona?" And the answer is, well, maybe. Yeah. But what if that doesn't go so well? What happens if there's this moment and you're like, "Oh my God, I know what to do in my home state, but now I'm down here in Arizona or whatever, and I don't know anybody down here, and I'm not local, and I can't pretend to be local if I go buy a condo in Scottsdale." That's nothing. That's just that doesn't do it. Yeah, so you really have to dig deep and understand what's important to you. And the answer might be, yeah, we're gonna expand and we're gonna go do this. But there's a lot of layers to think through before you jump into that. I mean, it's good you guys are thinking about this at this stage, because it takes a lot of self-reflection to really figure out if that's the right decision.
It does. It's tough. I love the industry like you do. It's tough. I want to share, because you shared that funny moment, I want to share a moment that Tripp and I had at Rosemark, where I'd never experienced this before in my entire life. Tripp and I walked in to teach boxing, and the entire group of residents applauded as we walked in. I'm like, I didn't know how to react. It was the cutest moment, I think, from there. I know Tripp fell in love with it. And those moments happen pretty much every day you're in there, if you look for them.
Well, they're there. They absolutely are there. And it's just this, this sense of appreciation, because the reality is, our residents, not all of them, we have people in their 70s independent living and they're still working a job, and we have people in their 90s that need help, and they know they need help to keep going, but they're motivated. They want to keep going. They want to stay there and be there for their family and spend time with their grandkids or great grandkids and pass down that family history and those important things that make families. So that's a big deal, and we see it every day. But like you said, you got to go in and look for it. And the great thing is, you don't have to look too hard when you go in there, because if you're giving your time, I mean, that's really a reflection of what you guys are doing there and how you're doing it. I mean, they look forward to this, when you guys are there, and it's a big deal. Can they go to Orange Theory next week and do a class? Absolutely not. But they can do chair exercises, your boxing class. It's much less intense. But they're, what they're doing? They're keeping their body moving. They're keeping their mind active. And those are the things that are super important. And I have seen so many examples. If you open your eyes and you look around, you see so many examples of that happening in our communities. And it's really motivational. It really is, because the people that, are working hard to keep their body healthy, to keep their mind healthy, and are able to do that. I mean, it's fantastic to watch that unfold. Now, unfortunately, there are diseases out there that prohibit many people from being able to experience that. We see that every day too, and it's not always because of choices that you made. Sometimes it just unfortunately happens.
Yeah, no, you hit the nail on the head on that one. I want to touch on your partnership and the dynamic, but you mentioned Susan, who's hugely instrumental in the success of this entire operation. I watched a podcast. I can't remember what it was on. It was last week, and she was, obviously so bubbly and just, portraying the energy. And I want to kind of go over, like, how does that dynamic work between, do you guys section off, like, I'm in charge of this, I'm in charge, how do you support each other, and how does that work together for you guys? Because I know that brings, it's difficult, but it also brings on a strength if you find that dynamic.
Yeah, that's a great question. And I mean, I think it goes back to, Susie, my wife. I mean, she's one of these rare people that has been in senior living her whole career. She majored in gerontology at Ohio State. She interned in senior living when she was in college, and she went directly into it, her first job out of college. That does not typically happen in this business. It's just not, a business that, there's not a lot of, academic programs that focus on it. There are a few. There's not a lot. Should be more, in my opinion. But, a lot of people kind of fall into this business by accident. That's how I got into it. You came into it by accident, but what's happened so fast is you get in there and you realize, like, man, there's all these things in the senior living business that feel really good. It feels really good about what you're doing. You're making a difference in the world. You're making a person's last chapter of their life very comfortable. You're providing their family the peace of mind that they want, or in need to know that mom and dad, they're the people that they love the most in this world are going to be cared for the right way in that last chapter of their life. Provide wonderful venues for these family moments, big birthdays. You bring in grandkids, you bring in great grandkids, multiple generations in a single room. It's just really a beautiful thing to watch unfold. But yeah, I mean, so we come at this business from two different sort of lenses. I mean, hers is the operations side. That's where she cut her teeth in the business. She was an operator, worked for she started in skilled nursing, did that for many years, and then worked her way into senior living. And so she was an operator there. I came to the world through the finance world and really kind of more of a real estate. It was interesting to me. So, but now that's we had in the early days, we had really to do it all. We didn't have a big team to lean on to help us get things done. So what we had to do in those early days was, I couldn't just be focused on the numbers. I had to help with the operations side. And when I needed help with the, financing or whatever it is, she had to jump in and learn that too. So we really sort of ended up doing, whatever had to be done. And there was a time when our home office was very small. It was the two of us and one other person. Now we're fortunate. We have 17 people in our home office that help support the operation. So, we have a lot of subject matter experts that really help us drive the business forward in a very, quality driven way. But we weren't always there. So we've had to sort of, lean on each other and just kind of do whatever it took to get it done. And sometimes that meant, learning something new and really listening to that person. Like, look, I've been doing this for many years. I've seen this successful. Let's really work through this issue, whatever it is, and figure out the best answer. And so that's, those were days weren't that long ago, but we did work through it, and now we have great teams that help us push the rock up the hill on an everyday basis.
Yeah. Every day. Yeah, that dynamic is it's fluid, and I don't think you ever figure it out. I mean, I don't know if you have a different side of it, but I don't think it ever gets figured out. I think it's an always evolving process of how can we be better at what we're doing. Not to say you don't get to a point where you have a great system, but I think it's always evolving, right? Always trying to improve ways to get better, or how you can work more cohesively.
Yeah, it's interesting, Brad. I mean, it's an interesting one to think through, because I think a lot of people really felt like they understood this business through February of 2020. And then the world changed, and it's not going back to where it was.
For
I mean,
sure.
the business is completely different in the post-pandemic world. I mean, we had to struggle through a couple years that were just extraordinarily difficult. But we knew that this was going to change how we looked at the business, how we ran the business, and it did. And our business today couldn't look any different than it did 4.5 years ago. Now, maybe from the outside it looks very similar, but the way we do it is very different. It's very different.
I can't imagine that time. That time must have. I mean, I can't even picture what you guys. I was running a gym at the time, a small facility. What we went through was. I'm trying to picture that on your scale.
Yeah, I mean, quite frankly, it was frightening. When the pandemic first hit, you hear about Kirkland, Washington. I mean, that was the big one, the nursing home up there where so many people got COVID, and it was not pretty. We were fearful for massive loss of life, and we made some decisions very early on. We needed to really make sure that we communicate with our families, do the right thing. We literally hired a crisis management public relations firm to help us message this out. This is a firm that helps message out really tragic, events like school shootings and things like that. We hired them, and they helped us create communication plans that we worked through, and it taught us how to write letters. We were writing letters to families sometimes multiple times a day. We were having to put time stamps on there, like this is the morning, okay, this is the afternoon, this is what's changing. It was changing so fast. But I think we have managed through that, as best as we could. And here we are 4.5 years later after the very first COVID case crept its way into the United States, and to this day, Ascent has never had a COVID death at one of its communities.
Wow.
Nice.
Wow, that's huge. Wow, and I'm sure you've learned from that. Now, there's not going to be another crisis. Let's not think that way. But I mean, at least you feel prepared for more. If something comes up, you're like, hey, we've done something difficult like this before.
Yeah, I mean, you are. I mean, in this business, like I said, in probably any business, when you think you got it figured out, there's going to be a change in the market, a change in the regulation landscape, whatever it is, a change in your consumer. So you have to be nimble. You have to be looking for that. And I think we do. And that's, we're like I said, we're at our communities. We're watching what's happening. We're seeing trends. And, there's a lot of people out there that aren't innovating right now, and that's probably not going to end well for them. You have to really be looking for what's next and how do we do things differently. Not only did the pandemic happen, but the labor market's changed substantially around here. And so, when you do that, you have to really, be in tune with what does it take to be a good employer today. There were times when people could have literally made more money staying at home and not working than coming to work. So the people that came to work every single day, it's like, man, you guys we're on the side of the angels here. We've got people that truly care about helping other people, and they're doing it, and they're literally taking a pay cut because they could be at home doing nothing and making more money. That's the situation we were in. Those were scary days, but we're nowhere near that anymore. But attracting talent, being a good employer, providing good benefits, providing competitive wages, and getting people, to the point where they want to stay and they want to work from you. And beyond that, they want a career in senior living. That's really what we're trying to do. So career pathing is something we talk about a lot as an organization. Like, how can we take people that sort of raise their hand and say, hey, I think I've seen this side of the business. It looks interesting to me. I'd like to dip my toe over there. So that's a big deal and something that we're working on actively.
Did you have sorry, you want to jump in, Trip?
Yeah, I wanted to ask too. So we kind of talked a little bit about where things are going with senior care, especially a study showed that 98% of all seniors with 55 and above want to participate in some sort of wellness programs, fitness, nutrition, those kind of things. Have you seen a big jump in participation in classes, eagerness to do fitness and wellness? How do you see that as part of your business here?
I think it's something that you have to be intentional about. In your communities, you have to have a place where that can occur. and you don't have to have a full-size gym. Some of our communities have wonderful gyms. Some have swimming pools. You have to have a place where it can occur. You can bring in instructors, like you guys, come in and provide a meaningful session where they come in a couple times a week. They get a great workout, and it's there. But yeah, I mean, we see that if it's offered and we message it out and we continually sort of, hey, we try to bring in participants, that we do get good participation. And those are some of the best, sort of life enrichment activities we can offer, because not only are they together and they're as a group and they're with their peers, they're with you guys, you're younger, and so they like being around younger people, and they're working with their bodies. I mean, I heard this saying a few years ago, and I love it. When you rest, you rust, and these people are not. They're not in that mindset. They want to keep going. They want to be there for their family. They want to. Instead of relying on medications or whatever. I mean, they want to try to do what they can on their own to keep going and to keep living that healthy life. I mean, I see it happen, all the time.
Mm-hmm. And or before I bogart even more the mic, Bethany, did you want to jump in? I know you had a question. I do that sometimes.
It's okay. No, I just love that thought, that making it available. And I know from people I've talked with, like, that's one of the biggest things that the families love, is knowing that there's a swimming pool, knowing that there's classes, knowing that there are options for their parents to look into and to be a part of and to enjoy. I know that's huge for the families too.
It is, and it's not like you have to be an athlete to participate in these things. I come to our communities, and a lot of times in the gym you might see, 3 or 4 rows of chairs. And you're like, well, what are they doing? Well, they're doing chair exercises, but that's what they can do, and they can do it safely. We certainly don't want to do an exercise where a fall could occur. I mean, that's what we absolutely don't want that to happen, because we do everything we can to prevent hospitalizations. So we have to be safe about it. But there's other things that happen too, and sometimes the residents bring ideas to us. This was something that happened about 2 years ago. I met a new resident at one of our communities, and I'm getting to know her. It's a happy hour on a Friday, and she's very talkative. And
as they are.
Well, happy hours are a big deal at her. Yeah. So I meet her, and she starts telling me about what she's doing, and she says, "Oh yeah," and then I'm on my over 80 women's softball team, and we got our practice tomorrow. I said, whoa, wait a minute.
The Peaches?
I said, what? Yeah. She says, I'm on an over 80 women's softball team. And I said, you have to tell me more about this, because two of my two boys play baseball, so I'm at a baseball field like all weekend, every weekend, and I'm just like, I'm just enamored by what I'm hearing here. So she's like, yeah, she's like, there's a softball team, the Colorado Peaches, and we practice the first 3 Tuesdays of the month, and the last Tuesday of the month we have a game. And she said, our last game is next week. Can you come? I said, I won't miss it. So I went. It was Halloween. It was our last game of the year. I went and I saw just this amazing showing of women, and it wasn't just women in the 80s and 90s. There's women in their 60s, 70s, 80s, and 90s.
Yeah.
But yeah, the particular resident I'm referring to, at the time she was 88 years old, and she's playing second base.
Yeah.
And so, or shortstop it was, shortstop. So
That is awesome.
It was fantastic. And so it's created this wonderful partnership in the last 2 years. We've sponsored them the last 2 years, and they have their big, they call it the Peach Bowl. Their big game of the year is coming up actually 2 weeks from today.
That's so cute.
So we're doing that over at Attenborough Park in Lakewood.
Oh, okay. Wait, so
Nice.
Is it called Edinburgh? Is that that's the name of the park?
Oh, Addenbrook, maybe that's it.
Okay.
Yeah, Addenbrook Park over in Lakewood.
Okay.
So they had it there last year too.
Interesting.
Yeah, we make it a big deal. I mean, we have our culinary teams come, and we bring hot dogs, bratwurst, and Cracker Jacks and peanuts, and make it just kind of a fun atmosphere where it kind of feels like an old baseball game. That maybe they attended when they were young girls. But that kind of environment. And so last year we had the mayor of Lakewood throw out the first pitch, and it was kind of a big deal. But it was a lot of fun, and we all have a good time with it. So it's a great organization. The resident now that's there. I mean, she's 90 years old. Last year at the Peach Bowl game, she was playing shortstop in the the second baseman was 91, and they hit the ball. It was so great. They hit the ball to the shortstop. She turns around and she gets the out at second.
Yeah.
And I turned around to whoever I was sitting beside, and I said, "That was a 181-year-old play." You know, the 91-year-old to the 90-year-old. It was fantastic. But they're out there. They're it's healthy aging. They're staying active. They're doing this on their own, and so this is just an organization I really feel like we are so happy to support.
And to provide an activity like that and to put it on a pedestal and help it become a thing is incredible. I want to touch quickly on, we talked about programs for the kids. What an important thing in having the kids connected to the senior program. Would you mind just real quick talking about what you guys do in order to facilitate that? It's important for, the communities you have to have kids of all ages coming in and volunteering and helping. Would you mind just touching on how you guys do that and approach that?
Yeah, sure. I mean, it's the intergenerational programming is a really cool one. A lot of times it's family members, it's grandkids coming in to help. Our own kids come into the communities and volunteer and help out. But just coming in and doing something, very simple. Being there. We had last month we had what we called the Ascent Olympics. So we had independent living residents from several of our communities get together and do fun games together and compete against one another. Kids were there helping out. They're helping with the games. They're helping serve food and drinks, things like that, and just kind of being there with the residents. It was quite a fun day. But yeah, it could be something like that. It could be something as simple as helping out with a birthday party, but just having them there and having those two groups interact. We're literally, their age groups are going to be 70, 80 years apart, and just being able to be there one another and just share a moment, talk to each other, you're going to learn something from both sides. And it's really cool to sort of watch that happen. And it happens pretty naturally. We don't put them together and try to, challenge them to learn from one another. If they're together and they're truly creating sort of this little bond while they have this moment, they're going to learn from one another. And I think that's super important. It energizes our residents, to see the youth in the building, in the community, and to see these young kids there, and the kids are learning from their elders, and that's really important. I mean, you've got to, these are incredible people, incredible people that live in our communities. They've done some of the most amazing things. They literally helped build this country. They're full of wisdom. They're not as able-bodied as they once were,
For sure.
but the amount of wisdom that they can share is a treasure. It really is.
We've had a lot of people ask to volunteer. What's the process? I know we did talk about there is a very. Could you cover that if you don't mind? Just kind of go over that process again.
Yeah, I mean, for someone who wants to volunteer, on a more regular basis, we are a regulated environment by CDPHE, the health department, and so there is an orientation that one must attend. We offer those on Tuesday mornings at our home office. You come there, you get a free Jimmy John's lunch if you come and do the orientation.
Trip is
All right.
there.
Trip is there.
All right, I got my first volunteer.
Ready.
I got Trip. Yeah.
You're offering.
Every Tuesday.
Every you can only do it once, Trip. Only one time.
Limit one.
Still do it.
So they come do an orientation and then they can volunteer regularly. We love to have volunteers at any of our communities. There's just a myriad of activities they can participate in, and it's great. I mean, it's not just for kids; it's for all ages. So if it's of interest, there is a process, but it's one that's that we can help people get through pretty quickly.
That's awesome. That's so cool to see. I look forward to seeing a lot more of that. There's no way we're going to get through all these. I have so many good questions. I do want to give you one more. Any top performer in your facility, whether it be an executive or an employee, is there anyone you can think of recently who maybe has been doing an insanely fantastic job, or maybe you saw an experience where you're like, whoa, that person exemplifies what we are all about? Do you have anything in your mind that comes to mind at all?
Oh my
Shout
gosh,
out.
it happens. I mean, honestly, that's a hard one because I see it happen. I mean, every week. And it probably happens really every day because, and a lot of times it's these things that nobody else sees. It's these things that happen where somebody needs a little bit of extra help, and they stay and they help that person. They get through whatever it is they need. But it's the things that for you and I are probably pretty easy to do right now. But for someone else, if you're 95 years old, taking a shower by yourself can be scary. Because you're one fall away from a hospital visit, and you've seen friends go to the hospital and perhaps not come out or come back very differently. So we look for that stuff, and it's a tough business, because you've got expectations from family members that they want their loved ones to be cared for in the best way, and we do that. But sometimes it's like, look, no matter what we do, one thing's for sure, like your loved one is at a stage in their life where a fall is going to happen. We can't be there, to catch them no matter what. And so when that fall happens, we need to, be there and help them out. And that's on the the more frail side of the business. But yeah, we have team members that go above and beyond all the time. And as I say, we're on the side of the angels. We hire people with big hearts, and they give and give and give. They really do. They put themselves out there. It's hard work. You're helping someone, get dressed in the morning that might need help. It could take two people to help a person get out of bed, and that's physically demanding work, And so, I always look to our caregiving staff. They work hard. They're there 24 hours a day, 7 days a week. They are doing the hard work, and that's the bulk of our employment base right there, that group. And we try to let them know they're appreciated, but you literally just can't say enough thank you to them, because they're there and they're helping these residents live their best life. And so, man, your question's a great one. Like, do I have somebody I want to single out?
100 different people.
I want to single out 500 people. I really do. It's hard work, and we feel really blessed to have, some dedicated people. We've had people that have worked for us for a very long time, 10 plus years. And if you get that, like, they stay for a reason, because, we appreciate them and we let them know that. So, not to say we don't have turnover. We certainly do. It's a high turnover business. But we get those folks that stay. My own grandmother, she lived in one of our communities, in 2018, and her caregiver still works there. And every time I see her, I just think of my grandma, and when she was there, and the smile that was on her face when our caregiver came and helped her out. It's really cool to see that happen. And that's just me. We've moved in thousands of seniors into our communities, and so this little moment I'm sharing happens, literally every day. So it's really cool. It's really cool to see happen, and that's one of the things that just makes you feel good about this business. Is like, hey, there's tough days, not every day is going to be great, but we are making a positive difference. Things are good. We're doing the right thing. We're helping these residents. We're helping their families, and so that does make us feel good.
Now, that is an enormous shout out for the people behind the scenes who sometimes don't get the appreciation. So it's all about the teamwork. I have a million other questions I want to ask you. We're gonna have to maybe have you on again if you ever. Final thoughts, Bethany. Final thoughts on anything that happened.
Yeah, I think the intergenerational point is so good, and I think it's those experiences that will help to create the people that want to work in senior living in the future. When those kids have such good experiences with the elderly, with people much older than them, different generation, they're gonna remember that. And when they're older, maybe get into care or become a doctor or nurse or therapist or.
Yeah, and that's a great point. And a lot of the caregivers, the caregivers that work for us, they grew up in an intergenerational household. They had a grandparent that lived with them. They watched their own loved one struggle with this stuff, and they have seen it, and they instinctively know what to do. So but not everybody does. Some people, their grandparents live on the coasts, and they never get to see them. So having that, having these elders in their lives is something that could be new for them. And so, it's I appreciate you bringing that up. It's a very cool part of the business.
Trip, your thoughts, good sir.
Final thoughts is I just want to say thank you for having us at your facilities. Get to working with this demographic every single day. there's a million reasons why it's so important to Brett, Bethany, and I working with these people. But I just think it's amazing that you are progressive, innovative with what you're doing, and I think that's one of the most important things getting into this industry is it's changing so fast. So I got to give you guys kudos for a great community, understanding what the future holds, and we're just so excited to work with you. Thank you.
I want to say thank you to the listeners for joining us again on this awesome podcast. I'm sure we're going to get questions and comments and stuff like that, and maybe we'll find a way to send them to you, or if people want to reach out and are interested in the volunteering process, maybe get in touch with you that way. But is there a way, if somebody loves what you're doing and wants to get into it, is there a best way to approach hey, I want to get involved? Is there an email? Is there, hey, reach out to the support team? How do people get involved in what you're doing?
Yeah, I mean, I think for the volunteers, we have kind of this generic email address that can be accessed. It goes to our human resources team, but they would be kind of the intake on this. And it's simply HR at Ascent LC, that's ASCENTLC.com, HR at AscentLC.com. They can send an email to that email address. We can get their information, schedule orientation, let them come in, and learn more about that.
That's fantastic. Nice. Awesome. Well, thanks again. So I know you had a million things to do today. Thank you so much. Appreciate your time. And also the listeners, hope you have a great rest of your day. Take care, and we'll see you on the next episode. Health or High Water.
Bye.